Hi, my name is Steve Swartz, Interventional Radiology, Mayo Clinic Health System. I chose to become a physician assistant because I enjoy caring for people and serving people, and medicine is certainly a area where you can do that. I also enjoy science a lot. Growing up, those classes came the easiest for me, and so it's just seemed like a natural combination of science and, most importantly, caring for people. So when I'm meeting a new patient in clinic or an interventional radiology clinic or hospital, I tend to like to try to find a personal connection with them. So sometime during the meeting, I'll talk about something that's maybe totally unrelated with why they're coming to see me. A lot of times I like to talk about hobbies they may have, pastimes they enjoy, where they're from, sports teams they root for, and a lot of times we can find some personal connection in those situations, and it's fun to get to know patients on that level as well. I'd describe my practice philosophy as patient-centered. I think there's three components to that. First, when they come in, I like to hear their story. I can get so much information from them, from their chart, maybe previous providers they've seen, and know their background a little bit, but I really like to hear what is their main concern for coming in. So listening to their story is the first thing. And the second thing is I like to educate them on their medical disease process they maybe have going on. And the nice thing about radiology is usually there's some images there where we can look at pictures together, or I can discuss different tests they've had and make sure they know what's going on with them. And then the final thing is to make a plan. And I feel it's important to make a plan together. I feel honestly in medicine there's a lot of times where there's a few different directions or paths you can take, and so I want it to be something that they feel comfortable with, that they feel like I understand them, they're educated and they're informed about their decisions they're making, and then we're making a decision together. I think the best part of my job is interacting with patients and getting them to feel better. With health, it's an important part of all of our lives. I know with myself, if I'm not feeling well, I'm just not the best version of myself. But when we all are feeling well and doing well, I think we can become better versions of ourselves. And it's neat to be a part of medicine where I can help people become better. Steve Swartz, Interventional Radiology, Mayo Clinic Health System.